component resolved diagnosis is actually molecular allergology. It means that we look to the allergen from different sides. So, for example, if you would be allergic to an elephant, you can be allergic to the tail or to the front, to the big ears. And so all the different parts you can be allergic to, it's the different components. So that's how I make it visible for everyone how to understand. So we can measure whether you make IgE to the tail or to the ears or to, it's the same with an allergen, with the grass pollen. So you have different epitopes where you can be allergic to, and with the components you can measure the different allergens and their allergenicity. Now, how can we use it? It's mainly used for diagnosis or help in diagnosis of food allergies. In food allergies, for example, you have the problem that some food allergens are very dangerous and can lead to death, to severe anaphylaxis. Some are a little bit less dangerous and you can have troubles, but not so much as dying immediately. So there your CRD can help in trying to find out to what you are allergic and whether you should, for example, have an EpiPen or not.
So component resolved diagnosis is a means of looking not just at whether a patient has a specific IgE against the whole protein extract from a known allergen source such as dust mite, tree pollen, grass pollen, but looking at whether they have IgE that binds to specific allergens or specific proteins within that protein mix. The relevance is that we know that sensitization to certain proteins within the protein mix is more closely associated with disease than sensitization to other proteins. This can empower us to know whether a sensitization is likely to be relevant to a person's symptoms. Good examples would be with silver birch pollen, where the majority of patients who are sensitized who have symptoms will be sensitized to the major allergen BETV1, whereas some other patients may be sensitized to more minor allergens like BETV2, and if they're sensitized to those without sensitization to BETV1, they may well be asymptomatic but still have a positive total IgE or skin test.